you all to take a moment to think back to when you were 5 years old. Do you remember when people would ask you what you wanted to be when you grew up? I would make a bet that at least one person in this room would have said a doctor. Now, the thought of keeping a patient alive or performing brain surgery might seem daunting, but what if I told you that brain surgery is about to get easier? Good morning. We are Triangle Medical Innovations, a team of biomedical engineers from UNC and NC State working with Duke Neurosurgery to make this happen.
So let's talk about cancer, something that I think everyone is familiar with. I know from personal experience that watching a loved one go through cancer is a very scary process, from the first moment you find out about it, all the way through any treatments or surgeries that they must undergo. A brain tumor is a particularly scary form of cancer, as whether the tumor originates in the brain or metastasizes to the brain. Thinking about something so aggressive in an organ that controls all of your body functions is terrifying. In 2014, there were 700,000 people in the United States living with a brain tumor. And every year, there are 70,000 new people diagnosed with brain cancer. At Duke Hospital, we treat about 700 brain cancer patients every year in comparison with other hospitals, which only treat about 200 patients every year. One of the most common treatments for brain tumors is to have them surgically removed.
So every time a brain tumor resection takes place, a neurosurgeon will use the bipolar cautery device. As you can see, it resembles forceps, so it is used for dissection as well as cautery. Cautery is important in any type of surgery because it stops bleeding, but is especially important when dealing with a tumor because it cuts off the tumor from its blood supply. So when the surgeon wants to cauterize a vessel, they can grab it between the tines, activate the bipolar, and then this will burn through the vessel and seal it at both ends. The current activation method for the bipolar is a foot pedal, which is not tied down to anything and can easily be misplaced in the frenzy of neurosurgery.
So let's compare this to something that you all can relate to. So imagine that you're driving your car when all of a sudden a cat jumps into the middle of the road. You're about to go and hit the brakes, but all of a sudden you realize that the brakes weren't where they used to be. What do? You're either going to have to move your feet around and try to feel for it, or you're going to remove your eyes from the road to look for the foot pedal. Both actions will cause you to veer the car to some degree. And this is very, very similar to when a neurosurgeon has to abruptly stop bleeding in a brain tumor resection, and he's unable to find the foot pedal to activate his bipolars. All this movement right here, it's not ideal when you're working in such a delicate area. With all these difficulty in mind, it's not uncommon, it's just not good. And, and actually every year, 1 in 5 neurosurgeons will face a malpractice lawsuit because of this. And 70% of these cases are due to improperly performed surgeries.
This is why the problem we have decided to address is the need for neurosurgeons to have autonomous control of the cauterization tool in a way that minimizes unintended motion in the surgical field. In order to address this need, we categorized our design criteria into 3 components: minimization of movement, ease of use, and affordability, in order to make our product better, faster, and cheaper. And with these design criteria in mind, we came up with 25 initial ideas, everything ranging from variations of the foot pedal to mind control, and narrowed it down to 3 focus areas: activation by voice, by hand, and by foot. Now, voice activation was the neurosurgeon's favorite, but it's also the least feasible idea. We brainstormed ideas with vocal patterns, pitch, and frequency, but realized that the limiting factor of voice activation is in its feasibility. Distinguishing words in the middle of a surgical procedure, a delicate surgical procedure, would be very difficult, and validating this product would be an enormous issue.
We've also thought of moving activation to the hand. A couple of the ideas we came up with were a long button or slider on the side of the forceps, or a strain gauge that activates when the device is squeezed. The challenge with this would be that the device would have to be either autoclavable or sterilely packaged and disposable.
And as Jared previously mentioned, a lot of the current foot activation techniques require the neurosurgeon to remove their vision from the surgical field in order to find this foot pedal. So some of our ideas so far have addressed this issue by coming up with a way to anchor the sensor to the neurosurgeon's foot in order to allow them that activation, but also while preventing accidental activation that could be caused by walking or moving.
Now, our most significant competitors would be those working to improve the bipolar itself, namely AthroCare Corporation, Bovie Medical Corporation, and ConMed Corporations. Now, in addition to that, anyone innovating activation techniques that could be potentially applied to the bipolar could also be a significant competitor. So in order for our device to stand a chance against this competition, we've sought feedback from additional neurosurgeons, malpractice lawyers, and industry representatives.
So by the end of this month, we hope to have a developed concept for our solution. Our next steps focus on reverse engineering the current electrosurgical device equipment that's used. We hope to have a developed design for our idea by January and a working prototype by February 2016. We've also considered making 3 separate prototypes, one for each of the concepts that we mentioned before, to see which one would work better. And if all goes well, we hope to have a completed product ready to pitch to you in March of next year.
We are Triangle Medical Innovations, and we thank you for your time. We now open the floor up for any questions. Kate.
How do you think you can anchor something to your foot if they're wearing the disposable foot shoes?
So we've addressed this issue by thinking about potentially making the sensor compatible with those slippers. So we know that those are disposable, and then we wouldn't have to worry about any kind of autoclavable issues or sterile issues, but yes.
Cameron?
Although this device, or although your, proposed device isn't going to be in contact with the patient, what would be the FDA classification of it, since it's going to be used in a surgical room? Obviously, I'm sure there's going to be, higher standards for, something that's being used in surgery, more testing and such. They'll go into that before you're going to bring it to market, so that's my question.
Yeah, we've definitely considered this, and it will depend on the focus area we choose as well, but we might not have to have as much FDA clearance if we have, let's say, voice activation versus something that the user is wearing, the surgeon is wearing on their foot. So that's definitely something we've considered and thought a lot about, and we'll continue to think about in the future.
Ariana.
I don't know if I missed this. So are you guys just looking at designing the foot pedal to attach to already existing bipolar devices, or is this going to supply your own bipolar current? Are you designing a whole system? Can you do that? Can you do just the foot pedal in conjunction with another company's tweezer?
So there's an electrocautery device. It's like the generator. And the foot pedal right now is attached by a cord to the generator. So we would do something that would attach to the generator, which would then connect to the bipolar and activates it.
Does the same company make the current foot pedal generator and device?
Yeah, it's it usually comes in a whole kind of package.
Okay, so you're trying to replace one element of the package.
Yeah, the connection from the foot pedal to the unit is actually a characterizer. It's a common connection. There are 7 pins, and it's utilized by all the different manufacturers, so that different foot pedals can be utilized with different machines.
Yeah, our goal, I would say, is just to make a new activation for this bipolar that already exists. So hopefully our activation technique would interface with the bipolar that's already out there.
Quick question.
The voice activation idea is cool. Have you thought making it possibly optional so that can work with the pedal and also be turned on?
Yeah, one of the things that we were trying to do to minimize accidental activation was pairing 2 different techniques together. And that's about all the time that we have. Thank you very much.